decided to become a pharmacist when I was in the 8th grade. My science teacher at the time asked us to do a report on different careers in the health field, and I completed a report on pharmacy, and I just fell in love with it. While in high school, I shadowed a pharmacist, and that made me even more determined to go after my dreams. One of the main reasons I love my job and what I do is because I get to help people each and every day. So now I know you're probably wondering, what exactly is a pharmacist? Well, pharmacists have many job responsibilities, but to sum it up, we are medication experts. We work with doctors, nurses, and other health professionals to make sure that patients get the safest and most effective medications. We also perform important safety and quality checks on medications to make sure that patients are safe and that their medicine does not harm them in any way. And last but not least, we talk to patients about how to best use their medications. For example, the pharmacist is the person that will tell you how many times a day you need to take a medication. So if you love math and science, if you like helping people, if you like to solve problems and puzzles, and if you are very organized, then pharmacy is a career that you may be interested in one day. Now, I know many of you all are wondering, how long do I have to go to school to become a pharmacist? Well, for most people, it takes 6 to 8 years of school beyond high school to train to become a pharmacist. Most people complete a 4-year program and receive a bachelor's degree in a science-related field before entering pharmacy school for 4 years. After the completion of pharmacy school, you will obtain a PharmD degree, which is a doctoral degree. So although it seems like a lot of schoolwork, it is definitely worth it. After completing school, there are many different fields of pharmacy that one can pursue, which include academic pharmacy, which is like a professor at a pharmacy school. Then there's community pharmacy or retail pharmacy, like your local CVS or Walgreens, and that is the field that I work in. I work for Walmart Pharmacy. Next, we have government agencies like the FDA or the VA or the CDC. There's also hospital and institutional practice. So there are pharmacists that work at hospitals like Baptist, Lavana, and St. Jude. Then there is nuclear pharmacy, and those pharmacists work with radioactive drugs. There's also compounding pharmacy, and these pharmacists can put drugs in a flavored liquid, cream, gel, or suppository that is just right for a patient. So let's say you have a very bad sore throat, and since you are having a hard time swallowing medicine, your doctor may send you to a compounding pharmacy where they can turn your medicine into a lollipop and make it easier for you to take. And I can't forget veterinary pharmacy. So if you like animals, there are some pharmacists that only make or compound medications for dogs, cats, and other household pets. Speaking of compounding, I have a couple of items that I would like to show you today. This is a mortar and pestle. We use it in the pharmacy to make medications. We can use this to grind or crush tablets into powders, and we can also use it to make liquid products. And this is a pill counter and a spatula. So this is just a tray, and we use it to count out pills for our patients. So now that I've talked all about pharmacy, I have one more topic that I'd love to share with you, and that is medication safety. I'm pretty sure you all know to never ever take any medication that is not prescribed or meant for you, and please only take medicine from a grown-up that you trust, like your parents or the school nurse. Every year in the United States, there are about 2.4 million incidents that the poison control centers have to handle. So that's one incident every 13 seconds. I just want to encourage you all to always use medicine safely. Medicines are not sweets, and they can be harmful. Although some medications may look similar to candy, always ask an adult if you are unsure if it is medicine or candy. Medications can also be dangerous if you take the wrong amount. So please only follow the instructions on the label. And if you happen to have younger siblings, please tell your parents to store any and all medications out of their reach. It has truly been a pleasure sharing with you all today about what I do as a pharmacist. That's right, I once sat where you all are sitting many years ago. I also attended Oakland Elementary School. So once a star, always a star. Before I go, I just want to encourage you all to dream big and reach for the stars. You can do whatever you set your minds to. I hope you all continue to stay happy and healthy and have a great rest of the school year. Thanks.
Hello, my name is Kristy Patrick Lewis. I am a registered nurse with my master's degree, currently working on my doctorate degree in nursing. I enjoy nursing because I love to take care of people, as well as being a registered nurse that works at the bedside. I am also a nurse educator at the University of Memphis. I also teach nursing school as well as I am a nurse. Yes, you do have to have a college degree to become a nurse. The thing with nursing is you have to have the passion to want to do nursing. You can't, excuse me, you can't want to be a nurse just because mom is a nurse or because dad is a nurse. It has to be your passion and what you want to do in life, because taking care of people's lives is very important, and it has the satisfaction of giving you a smile at the end of the day, knowing that you left your patient feeling much better than they came into the hospital. Yes, I do work inside of a hospital and inside of a university. Currently today, I am recording this video inside of one of my classrooms at the University of Memphis. Some of the equipment that I use on a daily basis is my stethoscope that I have with me everywhere, even when I'm teaching my nursing students. I also have bandage scissors. And now that we're going through the pandemic, because most of you all are at school, in elementary school, and you have to wear a mask. I also have a mask that I wear when I'm around my students right now. My classroom is empty, but I have a mask. And I have nice eyewear, such as goggles, or in school, you all don't have to wear goggles, but we do when we're working at the bedside with our patients. Also, I do sometimes have to travel for my job. There are a lot of nurses that travel as a travel nurse in general. They go from different state to state to take care of patients in different hospitals, wherever the need may be. I got one more piece of equipment I'm going to show you that I carry with me on a daily. It is a pulse ox. It checks your oxygen saturation and your heart rate. It goes on your finger. Right now, I need to put new batteries in it before I go back to work. Also, I chose this career because I love to take care of people. I love to make people smile and make them feel better. I have no problem with the blood, with the other bodily fluids that you may see that comes out of your different patient bodies. I love it. And to describe a typical day, if I'm going to the hospital, I would already be at the hospital working on a floor. I have to be at work at 6:45 every morning, and I get off at 7:15, or that's the time I should get off. Sometimes we work a little later, but we work 12-hour shifts as nurses. It is real exciting. I have to go in, assess my patients, give them medications, and let them know what's going on throughout the day for their care. In doing so, I'm going to show you one of our mannequins that we use here at the school for when the students needs to practice for when I'm teaching them their different skills. These are the mannequins that the student use. And as you can see, it looks very lifelike. We got everything in this room that the students may need. We got the actual IV machine that we will use, the suctioning if the patient needs suctioning, and the suction regulator. We have sample patients charts that are in here as well. It gives you the doctor orders on what the doctor is prescribing, and the nurse, me being that nurse that day, will have to carry out those orders. We also have the best thing going right now, hand sanitizer, so for each student to use, as well as gloves in different sizes for them to use. This is the sharps container box that we put any sharps, such as needles or anything like that, in on the patient. We also have different setups when we come to the class. When I come to the class and teach, I have different setups, just like you would at school with your teachers, with your books and your tablets and all your art supplies. I have all the different supplies here that my students may use on those given days when they're in the classroom here when I'm teaching. I got all my different needle sizes and needles that we would use if we needed them. I have a whole supply closet of different things that will need to be, if we need to use them. All different size sterile gloves, which are different gloves than we use on a regular everyday basis. All the equipment that we need to learn how to make beds properly in the hospital, and other different equipment that we would use. This is also a lab room that we can use other different equipment. I really, really enjoy nursing. It is my passion. It is my joy. I wouldn't do anything else. I think that is why I started teaching nursing, because nursing is the joy of what I like to do. Just making people smile, making them know that you know that your family member is in good hands when I am taking care of them. We often have struggles in nursing, as we have right now with the COVID pandemic going on. Please, please wear your mask, sanitize your hands, sing the ABCs or happy birthday through twice. And that way you know that you are properly keeping yourself and your family healthy and clean throughout this pandemic that nursing didn't realize we might have to ever go back through. But please keep yourself safe at all times. And nursing is a passion. It's a joy. It's a gift. It is awesome. I enjoy waking up daily knowing that either I'm going to teach future nurses or I'm going to somebody's bedside to make their family member much more happier or feeling better. Just knowing that I got you feeling better from day 1 to day 2 is the joy. Just to know that, yes, you successfully walked in this building not feeling good, but I walked you out of that hospital feeling good with perfect joy and peace. I sent you home to your family in one piece. That is what I enjoy, what I love with nursing. I have been nursing now. I have been nursing at the bedside now for 9 years. Next year will make 10. I have been a instructor for nursing students for 5 years, going on 6, and I enjoy it and I love it. Hopefully in the few coming months I will be Kristy Patrick Lewis with a DNP behind it, which is the doctoring of nursing practice. You can do it. You strive for the best. You all are Oakland Stars, run by the best chief, the future Dr. Constance Wright.